What is an abnormal stress test and what do you have to do when you have an abnormal stress test? There are three different kinds of stress tests. One of them is just a treadmill stress test where you walk on a treadmill and they keep taking your EKG to see if there are any changes on the EKG when you're exercising. That's one kind of a stress test. Number two is nuclear stress test. They take imaging of your heart, before and after they perform stress tests. Either it can be exercise or it can be pharmacological stress tests where they give you medicine and stress your heart and take pictures of your heart before and after. And they compare the pictures to see if there is a defect where there's a perfusion defect. That means that a certain part of the heart is not getting the blood supply what it needs to because there is a blockage. That's another kind of stress test. The third stress test is a stress echocardiogram. That also tells you, whether your perfusion is good or not. So when you exercise on a treadmill, we take some pictures of your heart before you exercise on the treadmill, immediately a minute after you've exercised on the treadmill to see if a part of the heart is not moving well. That can suggest that probably you have a blockage in that particular vessel and you need further tests. So when you have an abnormal stress test, you will need further tests to see if you have any blockages in the heart vessels, because stress test is something where you're taking pictures from outside, you're actually not going in and looking at the heart vessels. And the two ways you can look at the heart vessels is one, coronary CT angiogram, wherein you can get a CT scan of your chest, just focusing on your heart vessels and injecting contrast to see if you have a blockage. And the second one is traditional angiogram, where they go with a catheter from your wrist or from your groin, going to the heart vessels to see if you have a blockage or not. The only difference between these two is coronary CT is not an invasive procedure, but coronary angiogram is minimally invasive. But the advantage with that is when they go in to do an angiogram, they can fix your blockage if you have any. So both of these tests are equally good. If you have an abnormal stress test, you need to get an angiogram done.